Now it's the time to start the international session. Today is the 1857th day of uninterrupted daily webinar of IFPH. Before beginning the session, let's have a silent prayer. Hello, doctors, students of homeopathy, and friends of homeopathy. Today is the 1857th day of uninterrupted daily webinar of IFPH. And today our guest speaker is Professor Dr. ARPANA BALDOTA. She is a professor at the Department of Homeopathic Repertory, Lokmanya Homeopathic Medical College, Chinchwad, Pune. Dr. ARPANA had more than 16 years of clinical experience. Today, our topic of discussion is skin disease and homeopathy, a case report on dermatitis. Let me welcome Dr. ARPANA BALDOTA, and I welcome you all for the session. Doctor, you can start, please.
Yeah, thank you, sir. Thank you so much.
Hello,
Am I audible?
Yes, doctor.
Yeah.
Able to see my screen.
Are you able to see my screen?
Yes.
Okay, fine. First of all, hello to everyone present over here. And I would like to thank IFPH team as well as Dhanesh sir for giving me a chance to present this seminar, that is skin diseases and homeopathy, and a case report on dermatitis. Can I start, sir?
Yes, doctor. We can make it full screen if you need.
Okay.
Is it possible?
Okay, full screen banana.
It's not a must. If you can't, let's start now itself.
No, it's okay, sir.
Yes, doctor.
Yes. So, homeopathy may be used to treat various skin diseases with some case studies, suggesting some case studies and outcomes in conditions like various conditions like psoriasis, warts, and eczema. And homeopathic treatment, whenever we give for the skin problems or skin diseases, we focus on a personalized, holistic approach and addressing psychological and physical factors contributing to chronic skin conditions. Now, if we go through how homeopathy may be used, in that we can go further with the first point, that is individualized treatment. In this, a holistic approach is taken considering the patient's unique physical, mental, and psychosomatic symptoms to select a remedy. Addressing symptoms, second point, and in this, homeopathy aims to alleviate the skin lesion and associated symptoms with the belief that if you prescribe right remedy, you can resolve the skin issues efficiently. And for the homeopathic treatment, third point, that is managing allergic reactions. As we all know, the allergic skin disorders such as eczema or dermatitis are often a focus for homeopathic practitioners. And last but not least, that is focus on chronic conditions. Homeopathic holistic strategy may offer a supplementary approach for chronic skin diseases, which can be influenced by either hereditary, environmental factors, and psychological stress. Now, today's my topic, and that is the dermatitis. We will go through this topic first. And in introduction part, that dermatitis is a pattern of inflammation with widely etiology characterized by pruritus with oozing some point in its history. Now, this term is having synonym, and that is eczema. This eczema is to distinctive reaction pattern in the skin, which can be either acute or chronic and are due to a number of causes. Now, the histopathology behind this dermatitis or eczema is first one that in the acute stage, edema of the epidermis progress and the formation of intraepidermal vesicles which may enlarge and rupture. And in the chronic stage, there is less edema and vesicular but more thickening of epidermis. And this is accompanied by a variable degree of vasodilatation and T helper lymphocytic infiltration in the upper dermis. That is what the histopathology behind the dermatitis or eczema. Now, if we go further, there are clinical features, but they may be acute or they may be the chronic. It depends totally on the symptoms, whatever we get. First, we'll go through the acute symptoms. First symptom is redness and swelling. Usually, these eruptions or usually this rash is with ill-defined margins. Papules and vesicles, rarely we can even see there are large blisters. Exudation and cracking, or there may be scaling as well. If we see that what are the papules? The papules are a small raised solid bump on the skin which is less than 10 mm in diameter and it does not contain pus. It is the part of rash. We can distinguish these papules on the following basis, and that if either they are solid, they are small, they are raised, or they are inflammatory. And then what is vesicles? Vesicles are small fluid-filled sacs or blisters on the skin, typically less than 5 mm in diameter, which can be caused by any allergic reactions, viral infections, burns, or insect bites. These are the acute symptoms which we get in eczema or in dermatitis. Now the chronic symptoms, it is usually vesicular and exudative. Then lichenification, that is a dry leathery thickening with increased skin markings, is secondary to rubbing and scratching. Thickened cracked scaly skin, pigmentation changes, and raw sensitive swollen skin from scratching, that is one of the signs of chronic eczema or chronic dermatitis. Then further, we will see about the classification of eczema or dermatitis. In that, this dermatitis is divided into 9. And first one is atopic dermatitis, seborrheic dermatitis, discoid dermatitis, irritant dermatitis, allergic dermatitis, steatotic dermatitis, gravitational dermatitis, lichen simplex, and pomfolix. Now, one by one, we will go through the images of all this eczema and or dermatitis, and we will see how they are or how they appear in the patient. Is the complete image visible?
Yes, doctor.
Yes, sir.
Yes.
Yeah. Okay, fine. So this is the seborrheic dermatitis. Now this seborrheic dermatitis is a scaly rash which is affecting the scalp. Here we can observe that on the scalp, which is due to dandruff, or on the central face or nasolabial folds, eyebrows, central chest, and upper back. These are the regions where we can find the seborrheic eczema. It is nothing but it resembles like psoriasis. It can be a marker of immunodeficiency, including HIV infection as well. Now, we will shift to second one, and that is discoid eczema. From the picture itself, we come to know that it is the coin shape, or it is also known as nummular eczema. It is common and characteristically consists of discrete coin-shaped eczematous lesion. If in the image itself, we come to know that everywhere it is given as a coin-shaped eczema or coin-shaped rashes, whatever we have on our body. It can be due to any chronic itchy condition. Many a times, itching will be the prominent symptom in discoid eczema. The next eczema is irritant eczema. Now, this irritant eczema mainly is we find in the patient when patient comes in contact with any detergent or any alkalis, any acids, any solvents or adhesives. So wherever we come in contact with these things, the irritant eczema is very common. The strong irritants which have acute effects, whereas weaker irritants commonly cause chronic eczema and especially of the hands. Here we can observe in this image that these irritant contact dermatitis or eczema is specially observed on the hands. Irritant eczema accounts for most occupational cases of eczema. Many a times we can find in the patients which are suffering this disease because of their occupation. Then the next eczema we will go through, and that is allergic contact eczema or allergic contact dermatitis. Now here we can get the pictures of allergic contact dermatitis. This allergy, it persists indefinitely. We cannot get or rule out that the area on which it can spread. It persists indefinitely and eczema occurs at sites of allergen contact and can secondary spread beyond this. The area which comes in contact with this allergen, that sites we can observe this dermatitis. There are many recognizable patterns of sites of eczema. Involvement such as of different organs of the body. The different organs which are affected by allergic contact eczema commonly are earlobes or wrist and umbilicus due to contact with nickel in earrings. Many a times we see that if the patient are wearing any ornaments or watches or jeans, hand and wrist due to rubber gloves and all this, we get the allergic contact dermatitis. I said you before that there are allergens which comes in contact. The few allergens are jewelry, watches or cement, even leather, shoes, hair dye, tattoos or cosmetics. These are the different allergens which can create allergic contact eczema or allergic contact dermatitis. Going further, we can have that is steatotic eczema. The picture or the image itself, you can observe there is a dryness in the patient. This steatotic eczema, here it occurs a dry skin and is commonly found in older adults. Low humidity, overwashing, diuretics, all these factors can cause steatotic eczema. Many a times, these adults, they get the itching complaint due to the dryness of the skin and which leads to this steatotic eczema. Going further, we have the next, that is gravitational eczema. This gravitational eczema, in the picture itself, we are observing that it is mainly on the lower legs. And it is associated with the signs of venous insufficiency or edema or loss of hair, induration and ulceration. In these gravitational eczema, we get that there may be the blood supplies that is insufficient or venous insufficient. Then edema may be the symptom prominently observed in this patient. Even in the picture or in the image, we can see that there is loss of hair in this patient. Next, next type of eczema, that is pompolix. Now this pompolix, it is intensely itchy vesicles and bulbule. Whatever the itching complaint is there, the patient is suffering from, it occur on the palms and palmar surface. Even in the sides of the fingers and soles. Whatever you can observe in this image, and this we see that there are all the rashes which are related to the fingers and the palm region. But for these pompolix, there are several causes, and which includes like atopic eczema, irritant, and contact allergic dermatitis or fungal infection. Many a times we find that due to moistness in our folds of the fingers, we can have these symptoms of itching and all that, which leads to pompolix type of eczema. Now, further, I'll explain you about atopic dermatitis, the case which I'm going to share. This atopic dermatitis, it is a common condition in children, but it's not necessary that it can be only found in children. It can found in any age. It is long lasting and it tends to flare periodically. That's why it is long lasting, because though we cure these symptoms, again and again, periodically these symptoms flare up. It is sometimes it is accompanied by asthma or hay fever. This atopic dermatitis most often begins before age 5 and may persist into adolescence and adulthood. Though it starts before age of 5 years, but still you can find the complaints which are flaring up periodically into even adulthood or up to adolescence age. For some people, it flares periodically and then clears up for a time, even for several years. Even I have seen in my practice as well, this type of patient in which we get the results for our homeopathic treatment for few years, but again it can flare after several years. Primary risk factor for this atopic dermatitis is having the family history of eczema. Even allergies or hay fever or asthma. In this type of patients, we get mainly this atopic dermatitis. It can be the risk factor if in some patient which are having family history in their, the eczema flares up in their families. Or there are allergies of any type of allergen, or there is hay fever or asthma. Now, the complications which may include in this atopic dermatitis, or the patient may lie in complication, that is asthma and hay fever, or scaly skin, infections, irritant hand dermatitis, or sleep problems. Even we can get this, few patients can start with the symptoms of asthma or hay fever, which are the complications of this atopic dermatitis. Now, to prevent this dermatitis, we can give few suggestions to our patient. First thing, to moisturize your skin at least twice a day. We can suggest to the patient that you can moisturize your skin at least twice a day. Take a proper wash and then moisturize your skin. Even you can try to identify and avoid triggers that worsens the condition. For example, if you can find out that you have an allergy of any detergent, or if you have an allergy of cement and all those, in that you can identify the allergen, or you can identify whatever is triggering your complaints or worsening your condition, and in order to avoid all these, you can find the solution or alternative solution for this all the allergens. Third preventive measure is take shorter baths and showers. Even we can ask the patient to take the shorter bath or showers repeatedly. Then next preventive measure is take a bleach bath, and important prevention that we have to use the gentle soaps. Instead of using the strong soap, we can suggest the patient to use the gentle soaps, and we have a very good variety of soaps in our homeopathic treatment as well. So we can suggest some of them. This was all about the atopic dermatitis and various types of dermatitis as well. Now, I will try to show you a case which I have already gone through in my clinic. This case, first of all, I like to tell you that this was the case in the COVID period. This patient was suffering from the complaints. She was visiting the allopathic treatment, but due to COVID period, she was not able to go for the frequent visits, and then she has shifted to homeopathy. Here, the case is of 10-year-old Hindu girl. She was a patient who came to my OPD on 14th August 2020. And she had a complaint of skin eruption since 3 to 4 years. Even she had a complaint of whitish scales with wet sensation. When she entered the clinic, at that time I have seen the rash and it was oozing out. There was a wet sensation. There was itching and pain as well. The eruption started from the ear and extended into groin region. When the history has been asked to the patient, she said that initially this rash has been started behind the ears. Right over behind the ears, the rash has started, and then slowly it has extended up to groin region. The complaint was first initially seen behind the right ear, and then this complaint extended to the left ear. As she has mentioned that she had allopathic treatment with adequate results. Here she has mentioned that this allopathic treatment gave her relief, but it was temporary relief. And so she has thought, or she has came to homeopathic clinic to get the permanent results. Along with this skin complaint, patient had the complaint of coryza with greenish discharge. She was suffering from this complaint of coryza since her childhood, and the complaint was aggravated due to cold and ice cream. But it was better by hot application. Her mother said, whenever I gave the patient or when I gave my daughter the hot water to drink, she feels better. So it was better by hot application, the complaint of coryza. Then about the physical generals, when I inquired to her mother, I got these details, and that was the appetite is good. Whatever the food which is served, she have that food, and whatever she had the food, it was the good quantity of food. Then about the thirst, it was said that she is of a thirstless kind of patient. Even when I inquired the patient, even patient said that I do not feel more thirsty. So whatever the quantity of water she drinks, it was nearly about 2 to 3 glasses per day. Desire she mainly had for spicy, that was 2+, but for ice cream and chocolates, it was 3+. She had aversion to bitter, and that way the patient, when I asked about thermal reaction, it was the hot patient. Mental generals. Though I have highlighted few mental generals, but I would like to tell the background of the patient. Here, the patient was handled by only mother. Her father was expired in accident. He had met with an accident, and whatever he had the death, it was on the spot. And at that time, this child, she was very, I think it was near about the just age of 3 to 4 years. So she didn't remember what she has seen about her father and all that. This was told by her mother before starting the case. But the thing was, whenever in the school and all those places, wherever she was observing the father of other children or her classmates and all that, she used to come at home and ask her mother that why my father left me. Why only we two are there at home? Few mental generals are over here, and that was patient was emotional and better by consolation. Whenever she missed her father or whenever she went through the scene where she has seen that her friends, they are chatting with the father, or in school when the parents meet and all that, when she returned the home, she was emotional and she felt better only when her mother, she has consolated her. So this complaint, that is patient was emotional and better by consolation, not only related to the father problem or not only related to the discussion about her father, but that way also she was more emotional. Even someone who is speaking in higher tone with her, still she starts crying. She felt emotional. That sensitive she was. Secondly, patient had a fear of water. Patient felt that whenever I asked about this symptom, that how she felt fear about the water. And it was said that once when we visited a beach, and at that time we came to know that she is having the fear of water. Third one, patient is having brooding tendency and she is very moody. After inquiring about this symptom, I came to know that though she felt bad about all those situations, but she never shared with anyone. She used to keep everything with her and she used to keep thinking on these topics. Whatever the past complaint or whatever the past things were there for this child, she keeps on thinking continuously. That was the comment from her mother. When I asked how you feel that she is moody and all that, she said that yes, whenever I ask her to take the study, she will never be positive every time. Only the thing we see that whenever she has mood to study, she do that. Or if she has a mood to do drawing and all that, she will do only that. That way she is moody. As I said previously about emotional and all those things, that she was missing her father a lot. These were the mental generals of the patient. Analysis and evaluation of symptoms with miasmatic analysis of symptoms. Here, I have mentioned the classification of symptom into mental general and physical general. The symptom that is weeps easily and fear of water, though the intensity is less, but these symptoms goes in the soric miasm. Amelioration by consolation and brooding tendency, these symptoms has more intensity, and again these symptoms are differentiated into miasm, that is soric miasm. That moody tendency of the child, it has the 2+, and again it is one of the soric symptom. Then the physical general, the thirstless and no itching, that two symptoms again are at the moderate level for the psoric miasm, but desire for spicy or desire for ice cream, Again, these are the prominent symptoms of psoriatic miasm. Scaly skin eruptions, whatever I have seen, even I'll show you the patient's photographs that how the eruptions were scaly and all those. Again, these were bifurcated, these symptoms into psoriatic miasm. There was coryza with greenish discharge, which slightly, or it is a moderate symptom, but it is of psychosis miasm. Here we can say that maximum symptoms has covered the psoriatic miasm, and so for this case, the background was the psoriatic miasm. Here I have shown some photographs, and that is the condition of the patient's ear lobes or behind the ear. That was the before how the patient was during the treatment part. Whenever I have prescribed, how was the condition, and after completing my treatment, what was the condition of the patient. What you are seeing about the before photograph, in these photograph, though it is the dry one, whatever we have seen, but it was for the second follow-up. In the first follow-up, when I observed, it was having the moist nature. The watery discharge was oozing out. Then the photograph is there of during, and then the of after, whatever the treatment I have completed. This is the repertorization chart, where we can see all the totality of symptoms or repertorial totality, what we can say. So, weeping easily, fear water off, consolation amelioration, brooding, mood changeable variable, then food and drinks, spices, condiments or piquant, highly seasoned food, what I said, she has desire for. Then desire for ice cream, desire for chocolates, which was the 3+ symptom. Then sides left, right, then, and sides right, left, then. Because I said initially that this complaints has started behind the right ear, and then it was shifted to the left ear. Then thirstlessness, which was the prominent complaint of the patient, scaly eruptions, and scaly eruptions with the whitish scaly eruptions, we can say. Now here we can observe that lycopodium, here this drug has covered the 9 rubrics, and the grades which was given, that was the 14 marks. Then phosphorus, again 9 rubrics were covered, but the grades what was given, that was 21. Similarly with the pulsatilla and sulfur, again the 9 rubrics were covered, but the grades which was given, and that was 18 and 12. Then arsenic, calcarea, argentum, belladonna, and so on. All these drugs were there, were in the list where they have covered the maximum number of rubrics along with their markings or the grades. Now, I have prescribed to the patient, that was the pulsatilla 31 dose. And along with the pulsatilla 31 dose, that was start dose, the SL, which was prescribed for thrice a day and 10 days. But this prescription, that is pulsatilla nigricans 30, single dose was prescribed after repertorization. Because if we see before the chart of repertorization chart, where we have find that the 9 rubrics were covered by this pulsatilla and 18 rubric grades were given. So for that purpose, this pulsatilla has been selected. But this pulsatilla was selected keeping in view, that is the intensity of symptom, totality of the patient, according to the Hahnemann's guide, and then this was followed by the placebo for 10 days. Whatever the totality of the symptoms we have seen, in that all the this pulsatilla drug, it covers the complete totality in all aspects. This is the follow-up chart. When patient entered on 14th August 2020, skin eruptions were there with sensation of weight, as I said you, that sorry. Yes. So the skin eruptions with whitish scales, sensation of weight, no itching and pain, and coryza with greenish discharge. So the pulsatilla 30 for 10 days, as I said you. Then after 10 days, when patient entered the clinic, symptoms were same regarding the skin, but coryza was better. Again, pulsatilla 30, one dose was given, and now at this time, I have given SL for the 15 days. As all the skin symptoms still persist, they were same, I have repeated this dose of pulsatilla 30. On 21st September, the symptoms were reduced, but whitish scales remains. Whatever the moistness, whatever the sensation of weight and all this was reduced, but the whitish scales remains. And so once again, I have prescribed pulsatilla 30. Though the dose was repeated, but the single medicine was prescribed. Again, for this time, on 21st September, I prescribed this remedy for 15 days. Because now, day by day, I was going through the case and I found that first coryza was better, but now the moistness, that whatever the rashes or eruptions are there, that has been become dry, as I've shown you in the picture. Then after 15 days, that is on 7th October, again the symptoms regarding the skin were aggravated. Now here I thought to change the remedy, and I have given the second prescription, and that is graphitis 30 single dose, because the skin symptoms were aggravated. Though the coryza symptoms were vanished completely, but the skin symptoms were aggravated, and so I thought to give about the second prescription. Now, by this graphitis 30 and after the 15 days, I thought that I should even see about all the symptoms, and on 23rd October, when the patient entered my clinic, all the symptoms were better. All the skin symptoms, what I found, which were aggravated on 7th of October, even that symptoms also were better, and so SL was prescribed to the patient. Again, SL was prescribed for 15 days because the symptoms were ameliorated. I wanted to judge the patient's symptoms, and for that I have given the patient SL for 15 days. But when patient entered on 26 November 2020, at that time symptoms reduced, skin turned towards the normal, and for that again the SL was prescribed, but now all the complaints were improved, and so I have given this SL for 1 month period. Even here in this picture, we can see that before this was the symptom, or this was the appearance of the eczema, and after the treatment, I have seen these results in this patient. Thank you. So the way we treat the patient with the homeopathic treatments, and if we go in detail about the skin complaints along with the mental symptoms and all the factors in the case taking, you can give the results by only the single medicine and with only the homeopathy without help of taking other system of medicines. That's what I feel. So I think everyone can even think of giving this complete focus on all the aspects of the patient and prescribe to the patient. Thank you everyone for your patience hearing.
Thank you, Doctor. It's an excellent session. And you selected the medicine according to the principles itself, and we watched it. The cure was according to the Herring's law cure itself.
Yes, sir.
And I think we have another couple of minutes, 18 minutes remaining, 22 minutes remaining, 22 minutes remaining. So we have enough time to have an interaction with the speaker.
Yes, sir.
I welcome Dr. Ram Pravesh Shah. Sir, you can unmute yourself.
Thank you, Dr. Bindu Raji, and congratulations, Dr. Arpana Madam. Very nice, excellent
The
session.
pardon, I cannot hear you actually.
Hello.
Hello.
Very nice, excellent session. Skin disease, dermatitis, and this the cause and effect. And mental cause is a very important in case of skin disease. Case presentation, select the remedy according to homeopathic phenomena.
I think you
Yeah, some
have paused
network issues with
somewhere.
him.
Thank you, sir. But and even we can go through the many cases of skin complaints. But one thing I have observed in my practice, and that was, yes, sir, that if we clear one of the case, the positive results flare up in the society and we can approach towards the next skin complaint patient, because by going through the one patient, I have observed in my practice that there are 30 to 40 cases which has approached me by just seeing the patient itself.
Okay. Usually, some doctors find it hard and difficult to prescribe these centesimal doses for, if the correct exact medicine is there, and if we prescribe in the centesimal doses, some flare up or medicinal aggravation may happen.
Yes, sir.
A lot of persons, a lot of doctors are shifting to these millisimoles. What about that? LM potencies? Is it beneficial? Why are you sticking to these centesimal potencies, or are you incorporating these potencies also?
Actually, sir, I have seen many doctors using this LM potency and all that. Even that are beneficial. But in my practice, I have used the potencies which are like 30, 200 and 1 mm and so on. I have not yet used the LM potency, but my colleagues and all this practicing the homeopathy, I have seen that yes, even they get better results by this LM potency as well.
Okay, that's great, and you are very confident on that. And the other thing is, by selecting the exact simillimum, you first of all, you differentiated the case, how approach the case, identifying the exact nature of the disease, identifying the disease itself, but never you try to prescribe according to the disease symptoms or the common pathological symptoms, and you hit the core with the rightly selected medicines with along the repetization and all. Can you just explain a little bit more about that? Because that also I am seeing that a lot of doctors are sticking to these multiple medicines and trying to alleviate the skin symptoms or pathological symptoms with the some pet medicines or something like that for that indicated medicines. I say.
Okay. Actually, I think if I'm not wrong, you mean to say that many a times we use the therapeutic drugs, is it, Dr. Binduraj?
Yes, yes.
Yeah. What I believe in my practice is that only the giving importance to the therapeutic drugs, it may cure, but you cannot get the permanent cure. Instead of that, if you go in with the mental general symptoms in detail, then we come to know the what is the cause behind all this. And it may give us a clue for giving the correct or exact simillimum. Many a times, the patient doesn't open in the first whatever sitting itself, we can say. But when the patient comes for the follow-up and all that, at that time, even patient opens up with us. So I think primarily we should even give equal importance along with the skin complaints for the mental general symptoms as well. So for that purpose only, I said that we should give the importance to the complete totality of the symptom instead of giving importance only for the diagnosis or for the skin complaints and thinking of the repeatedly therapeutic medicines like sorinum or graphitis or as well any other remedy like of skin therapeutic. So that I feel that we should get the mentals also in detail as well. Because many a times, whatever the skin complaints comes to us as being a homeopath, they are mainly having the chronic nature of complaints. Very rarely I've seen that acute complaints are with us for a homeopath. Because first of all, whatever the patient think, they go with the dermatologist and all these things, and then they come to the homeopathy. And nowadays, many even dermat physicians, they suggest the patient to go with the homeopathy as well.
Okay, that's nice. And the other thing which we might have a difficulty is when we are treating a case, considering the whole
Yes.
totality and all, and we are treating a skin complaint itself. If there is another acute emergency, what will we do? Usually, if we are contracting a fever or something like that,
Yes,
what will
yes.
be the modus operandi with you? How you will approach the case?
Okay, fine. Just I will think of the remedy, either complementary remedies or the remedies which follows well to that previous remedy. And then for that acute phase of symptoms, I will try to prescribe that remedy and I'll ask to stop this remedy for few days, whatever the period which I have given the remedy. And then I will, once the patient is out of the acute symptoms, and then I'll continue with this symptom because, with this remedy or medicine, because the whatever remedy or whatever the second prescription I'm going to give to the patient, that will be complementary or follows well to the first remedy. So that is, I think, better solution to for the acute complaints of the patient in between the chronic symptoms treatment.
Thank you, Doctor. And there's a question in the chat box. Which potency is better for graphitis in skin complaints? I have bitter experience with graphitis. Can you give a suggestion, Dr.
Yeah.
Jayalalitha?
Okay. Actually, here I have given the potency 30 because the susceptibility of the patient and all those factors, as I said, I have seen, and that I thought that graphitis 30 will be the better for this at the age of this patient. But even graphitis 200 I have tried in the skin complaints, and it also gives us the better results.
Thank you, Doctor. Okay, and when we are treating the skin complaints or this type of emergencies, means this type of complaints, what type of food we need to stick on? Do you prefer some food or do you find something difficult while prescribing homeopathic medicines while treating these type of skin complaints? Do we need to stick some special food or something like that?
As such, I am not stick to some any food or what else, but just the rule what I say to the patient for each homeopathic patient, not the skin complaint patient only, but I stop the coffee, I stop the raw onion and raw garlic of the patient, and that's it, I think. But not as such that just we can stop a few things that what we hear normally, that we stop potatoes and all those things. But no, I have not done yet that way. But just I ask the patient to keep that whatever the skin complaints, if they are dry skin, then I ask them to give the keep it with moisturizer and all that we apply. Or basically, once a time, that is in a day, I ask them to apply the parachute oil or something else also.
So in as topical application, we can use this coconut oil. And
Yeah.
do you advise these moisturizers, because there will be a lot of chemicals in this moisturizer? Do you prefer that or not?
No, mostly I prefer only the coconut oil over here.
Right, and we are having Dr. Dhanesh with us. Sir,
Yeah.
please. Sir, please.
I have seen just.
Dr. Arpana, it's really a very good session. You really mentioned about the disease problem, what are the skin complaints and how it develops and how it can be managed with homeopathy. And then I saw the case
Yes.
also was an excellent one. And the question answer session is more brilliant than the other one because your answers are really excellent. And this kind of discussions are the need of the hour because we need to study everything in a different way. Then only we will because the experience of a person is to be considered more good than studying a mathematica in detail because that the sharing and experience itself has a different point of view. But case taking is the very important factor to find the simillimum. And finding
Very.
simillimum and its potency, that also choosing the potency. There are people who are who have some prejudice about the potency selection. Everyone has different views, but the in our philosophy it is written that the intensity, the selection of the potency must directly proportional to the intensity of the problems or the
Yes.
case. In those cases, but still people believe that if you give some 30th potency or 1 of potency or 10 of potency to a skin complaints, it may get worse. But it's a wrong belief, I think. If the similima is the right one, it won't do much damage. And LM potency is some. Is it repeating? Is there an echo coming?
Let's
No, sir.
No,
echo.
no echo.
No.
I know. Oh, okay. LM potency, people used to say that if you give LM1 and still the patient is improving, and if you want to give more pressure to the patient, then you can shift to any other LM 1 to 2 or 3 or 4 like that. What's your opinion on that?
Sir, actually, I have not used, to be very frank, I have not used yet the LM potency in my practice. So I cannot tell you that about the LM potency, but just I have seen the results of LM potency in my through my colleagues and all that. But I have used the potency like 30, 200 and so on only.
Yes, exactly. But actually, Dr. Amar Nigam only uses 30th potency, whether it be an acute case or a chronic case or whatever may be. You may be knowing Dr. Amar Nigam in Pune.
Yes, sir. Yes, sir. Yes, sir. I know him.
We have spent 2 days with him in a seminar.
Okay. Now, even I have done the workshop and all that, sir. But even I have seen in his hospital also that they are giving only the 30 potency. But I couldn't make it in my practice to give only 30 potency, though I have
Yes.
done the workshops and all that.
Yes.
So I've continued with the same, that is 30 potency, 200 potency, and so on.
Yes,
Maximally, I prescribe 30, 200. Sometimes I require about 1 m.
Yes, that's how we people are also managing. But SARS still believe that the 30th potency can
Yeah,
do.
he
Yes.
believes only in 30 potency.
Yes. And people believe that 30th potency is a low potency, but actually it is not. It's
It
a
is not.
it's a
Very
form
true.
of potency. It's just like 1 of potency or 10 of potency, whatever may be. Because of the experience, sir is sticking on that. But to me, I used to do 30th potency, 1 of potency, 10 of potency, LM potency also in different cases, in different situations. That's why my methodology. But that also, whenever I get a result, why don't I stick to that? What's the need of changing my attitude? That's what everyone think. And this is also my, I would like to add to this session. Thank you.
Yes.
Hope we can have some more presentations.
Okay,
Okay,
the other thing, thank you, doctor. And the other thing is, Dr. Dhanesh, I am just having I need an open discussion itself, because in Ayurveda, whenever they are going to treat the skin complaint, they usually give a laxative at first and try to treat the patient thereafter only. And in a period with whole grain are a rarity, and fiber is not in our diet, these type of things, I think, are obstacles to cure. While we are taking the case, and if the person is having constipation, we might have jumped into some medicine, considering the constipation also, and we neglect the importance of fiber in the diet. And do we need a laxative to start with? What doctor think about that? Anything regarding that? Need to correct the diet, add some fiber stuff on the food, or need to take some laxative before treatment? Is it wise to add these things in homeopathy? We need to incorporate that.
Yes. Yes, what I do what I am actually usually doing is that I just ask my patient to take at least 2 small banana fruits just before as a starter in your food habit, whether you eat in the breakfast or in the afternoon session or in the supper. It will give you some kind of goodness to the patient in a whole. Not only that, if you usually the habit of people is that they used to take foods after food, but that sometimes that may be a bad habit, because it may produce some kind of heartburn, or sometimes, as you know, the fruits are digested easily than the carbohydrate, just rice or this this what this chapati.
Yeah, wheat and
Yes, wheat or or. So it is usually the people from the naturopathy used to say that it is better to take fruits before this wheat or rice. That will do good for even for skin condition. If you ask the patient to take more fruits and if fish, particularly certain food fish, that will give benefit, particularly chala. That's we used to say is also giving an excellent result.
okay. So, Dr. Aparna, you can
Yeah.
add more.
Sir, laxatives and all that, even for the, I think you have said about the skin complaints.
Yeah.
Is it?
Yeah.
In the Ayurveda, you said. No, but I have not yet tried the same, because I think that whatever the skin complaints are there, accordingly, we can even ask about the preventive measures to the patient instead of telling them to get the laxatives and all that. And as I said, that we can prescribe the similimum to the patient properly, and through that we can get the results.
Okay, that's great.
Yeah.
So by sticking to
One,
minimum itself, and just Dr. Dhanesh mentioned that we need to have some diet correction also,
yeah,
incorporating
diet
some
corrections are the
more
most
good
important.
fiber diet. So this will have good results. Anyway, it's a great presentation, and just I am thinking and just pointing out something which we don't need to stick on that, because it's all with Ayurveda, and we have our own USP to do things to alleviate the symptoms by hitting the core. So on behalf of IFPH, I think it's time to thank for the excellent session. Come with more sessions, ma'am, to this program.
Yes, sir, sure. Even I like to speak about the pediatric case taking and all that. Next session we will do for that pediatric case taking and all that.
Definitely. Thank you, ma'am. Thank you
Okay,
for
fine.
being
Thank
here.
you, sir.
Thank you all
Yeah.
for coming to this session. And it's time to start the Malayalam. Over to
Yeah, yes.
Dr. Mariamma John.